Hello, everyone, and a warm welcome. Before I start the presentation, I have a sincere request for all viewers. Please study the theory alongside the MCQs for a strong conceptual understanding. So, in this video presentation, let's solve some essential multiple choice questions that focus on Unit 2, anxiety disorders, phobia, OCD, GAD, panic disorder, and PTSD. For MCQs on more topics, subscribe to my YouTube channel. The subscription link is provided in the description. Let us try to solve some important MCQs one by one from the topic psychological disorders like anxiety disorders, phobia, and other types. Question 1. What is the most common type of anxiety disorder characterized by excessive worrying about everyday events and situations? A. Panic disorder. B. Obsessive-Compulsive Disorder, OCD. C. Generalized Anxiety Disorder, GAD. D. Post-Traumatic Stress Disorder, PTSD. The correct answer to question 1 is option C. Generalized Anxiety Disorder, GAD. Question 2. Which anxiety disorder is characterized by recurrent and unexpected panic attacks, often accompanied by a fear of having another attack? A. Social anxiety disorder. B. Specific phobia. C. Panic disorder. D. Agoraphobia. The correct answer to question 2 is option C. Panic disorder. Question 3. What is the term for an irrational and intense fear of a specific object or situation that leads to avoidance behavior? A. Generalized anxiety disorder, GAD. B. Agoraphobia. C. Phobia. D. Obsessive-Compulsive Disorder, OCD. The correct answer to question 3 is option C. Phobia. Question 4. Which anxiety disorder involves unwanted and intrusive thoughts, obsessions, followed by repetitive behaviors or mental acts, compulsions? A. Post-traumatic stress disorder, PTSD. B. Social anxiety disorder. C. Obsessive-Compulsive Disorder, OCD. D. Panic disorder. The correct answer to question 4 is option C. Obsessive-Compulsive Disorder, OCD. Question 5. What is the common characteristic of individuals with social anxiety disorder? A. Fear of heights. B. Fear of germs. C. Fear of social scrutiny and embarrassment. D. Fear of flying. The correct answer to question 5 is option C. Fear of social scrutiny and embarrassment. Question 6. Which type of phobia involves an intense fear of being in situations where escape might be difficult or embarrassing, often leading to avoidance? A. Specific phobia. B. Agoraphobia. C. Social anxiety disorder. D. Claustrophobia. The correct answer to question 6 is option B. Agoraphobia. Question 7. Post-traumatic stress disorder, PTSD, can develop following exposure to A. Everyday stressors. B. Traumatic events such as war, violence, or natural disasters. C. Common fears. D. Phobias. The correct answer to question 7 is option B. Traumatic events such as war, violence, or natural disasters. Question 8. What is a common symptom of panic attacks associated with panic disorder? A. Calmness and relaxation. B. Rapid heartbeat, sweating, and trembling. C. No physical symptoms. D. Improved concentration. The correct answer to question 8 is option B. Rapid heartbeat, sweating, and trembling. Question 9. Which anxiety disorder is characterized by persistent thoughts, memories, or dreams related to a traumatic event, along with emotional distress and avoidance behaviors? A. Generalized anxiety disorder, GAD. B. Specific phobia. C. Obsessive-Compulsive Disorder, OCD. D. Post-traumatic stress disorder, PTSD. The correct answer to question 9 is option D. Post-traumatic stress disorder, PTSD. Question 10. Excessive and unrealistic worry about various aspects of life, difficulty concentrating, muscle tension, and sleep disturbances are symptoms of A. Panic disorder, B. Specific phobia, C. Generalized anxiety disorder, GAD, D. Social anxiety disorder. The correct answer to question 10 is option C. Generalized anxiety disorder, GAD. Question 11. What is a key feature of specific phobias? A. Fear of social situations. B. Fear of specific objects or situations. C. Intrusive thoughts and compulsive behaviors. D. Recurrent panic attacks. The correct answer to question 11 is option B. Fear of specific objects or situations. Question 12. Agoraphobia often co-occurs with which anxiety disorder? A. Panic disorder. B. Specific phobia. C. Social anxiety disorder. D. Obsessive-Compulsive Disorder, OCD. The correct answer to question 12 is option A. Panic disorder. Question 13. What is a characteristic symptom of social anxiety disorder? A. Fear of heights. B. Fear of open spaces. C. Fear of public speaking or social interactions. D. Fear of spiders. The correct answer to question 13 is option C. Fear of public speaking or social interactions. Question 14. Which therapeutic approach is commonly used in the treatment of anxiety disorders involving gradual exposure to feared objects or situations? A. Cognitive behavioral therapy, CBT. B. Psychoanalysis. C. Humanistic therapy. D. Psychodynamic therapy. The correct answer to question 14 is option A. Cognitive behavioral therapy, CBT. Question 15. What is a common behavioral manifestation of anxiety in children? A. Hyperactivity. B. Aggression. C. Avoidance or clinging behavior. D. Elation and excitement. The correct answer to question 15 is option C. Avoidance or clinging behavior. Question 16. Which neurotransmitter is often associated with the regulation of anxiety and mood in the brain? A. Dopamine. B. Serotonin. C. Acetylcholine. D. Endorphins. The correct answer to question 16 is option B. Serotonin. Question 17. What is a common cognitive distortion associated with anxiety disorders? A. Catastrophizing, expecting the worst. B. Minimizing, downplaying the importance of events. C. Rationalization, providing logical explanations. D. Intellectualization, avoiding emotional aspects. The correct answer to question 17 is option A. Catastrophizing, expecting the worst. Question 18. Which of the following is not a symptom commonly associated with obsessive-compulsive disorder, OCD? A. Obsessive thoughts. B. Compulsive behaviors. C. Flashbacks. D. Rituals and repetitive actions. The correct answer to question 18 is option C. Flashbacks. Question 19. What term is used to describe an irrational fear of specific objects or situations that leads to avoidance behavior? A. Anxiety. B. Phobia. C. Compulsion. D. Obsession. The correct answer to question 19 is option B. Phobia. Question 20. Which of the following is a common relaxation technique used in the management of anxiety disorders? A. Exposure therapy. B. Mindfulness meditation. C. Electroconvulsive therapy, ECT. D. Token economy. The correct answer to question 20 is option B. Mindfulness meditation. Question 21. Which neurotransmitter imbalance is often associated with anxiety disorders? A. Dopamine. B. GABA, gamma-aminobutyric acid. C. Endorphins. D. Acetylcholine. The correct answer to question 21 is option B, GABA, gamma-aminobutyric acid. Question 22. What term is used to describe an anxiety disorder characterized by excessive fear of situations where escape might be difficult or help wouldn't be available in the event of a panic attack? A. Agoraphobia. B. Social anxiety disorder. C. Specific phobia. D. Generalized anxiety disorder, GAD. The correct answer to question 22 is option A. Agoraphobia. Question 23. In the context of anxiety disorders, what does the acronym OCD stand for? A. Obsessive correctional disorder. B. Overwhelming compulsive distress. C. Obsessive compulsive disorder. D. Overthinking and compulsive behavior. The correct answer to question 23 is option C. Obsessive compulsive disorder. Question 24. Which of the following is a common symptom of post-traumatic stress disorder, PTSD? A. Fear of crowds. B. Flashbacks and intrusive memories. C. Excessive hand-washing. D. Fear of heights. The correct answer to question 24 is option B. Flashbacks and intrusive memories. Question 25. Which type of anxiety disorder is characterized by recurrent and distressing thoughts, images, or urges, obsessions, followed by repetitive behaviors or mental acts, compulsions? A. Panic disorder. B. Social anxiety disorder. C. Agoraphobia. D. Obsessive-Compulsive Disorder, OCD. The correct answer to question 25 is option D. Obsessive-Compulsive Disorder, OCD. Question 26. Which age group is most commonly affected by separation anxiety disorder? A. Adolescents. B. Adults. C. Elderly individuals. D. Children. The correct answer to question 26 is option D. Children. Thank you everyone. Don't forget to subscribe to my YouTube channel Education and Teacher Education at Shoki Bilal.